Good morning, everyone. Since it is the top of the hour, we will get started with today's presentation. I would like to first just welcome you to the HQIC informational webinar. My name is Naomi Rasner. I am the Regional and Michigan Admin for the HQIC work. A few housekeeping announcements before we get started. We ask during the presentation and while you are not speaking that you please mute your phone or computer. If you have any questions during the presentation, feel free to use the chat box, which is found on the bottom of your screen. With that said, I will hand it over to Michelle Norcross, the Task Order Director, who will be delivering today's presentation.
Thanks so much, Naomi, and welcome everybody. I'm so excited to have you today and share a little bit more about the Hospital Quality Innovation Contract Initiative. So as you know, we are doing work under Superior Health Quality Alliance, and we are really excited to be offering the HQIC opportunity, which is really the HIN continuation in 3 of our states, Michigan, Wisconsin, and Minnesota. So we have partnered with an organization named iPro, and iPro is actually a QuinQIO out of New York State, and they have had a lot of tremendous success, and we're really excited about the partnership with them under the HQIC effort. So we're really focused on leveraging innovation across geographic regions to support our hospitals in reducing all-cause harm. And we also are going to be bringing together the expertise and resources of quality improvement organizations, established hospital associations, as well as national experts in patient and family engagement. So this is the iPro network for HQIC, and it's really exciting to be partnered with such fantastic organizations. So again, iPro, which is based out of New York State. We have Health-Centric Advisors, which is another QuinQIO, Kentucky Hospital Association, Clarent Health, which has historically been doing QIO work, but additionally was previously an NCD national content developer under the HIN efforts previously. The Q3 Health Innovation Partners, which includes the Pennsylvania and New Jersey Hospital Associations, and then Superior Health Quality Alliance covering Michigan, Wisconsin, and Minnesota. Again, the hospital associations working in each of those organizations, as well as our partners through Superior Health Quality Alliance. And then working again with American Institutes for Research, or AIR, which historically was the patient and family engagement contractor under HIN as well. So I'm sure you're familiar with lots of these contractors, but really excited to continue again this work and start some new partnerships to be able to offer our hospitals even more under HQIC. So the iPro HQIC approach is really engaging with us at your own pace. So we have a 6-month enrollment period of which hospitals will have the opportunity to engage in optional activities. We are in recruitment right now through the end of March, and we're focused really on peer-to-peer networking through the iPro HQIC online community. One-on-one technical assistance will be available for any of the 8 core areas of harm to you as a provider or in COVID-19 planning and response. We also will be recommending a PFAC advisor to participate on our iPro HQIC-wide PFAC, and then obtaining input on new tools and resources in development in any areas of interest. So again, this is what the optional activities are. We want you to be able to engage with us at your pace and really meet us where you need to be. iPro is going to have lots of offerings under the HQIC, and we're really excited to partner with them on this. So we're going to be able to offer technical support at no cost to your institution. That includes data analytics as well as benchmarking, data dashboards to engage your board, the PFAC and staff in quality improvement. We're going to be able to offer an ARC culture of safety survey, as well as opportunities to participate in patient safety learning collaboratives, patient safety resources and tools, peer-to-peer sharing platforms, as well as PFE metric coaching. We also have subject matter experts that are available to your organization at no cost again, including clinical patient safety, quality and performance improvement, data analytics and claims data access, rural and critical access hospital expertise, ECHO hubs, so project extension for community health care outcomes, patient and family engagement, health equity, as well as health high reliability. And so these are topic areas that, again, we've covered historically, but we are going to have those subject matter experts to even further help your hospitals. So again, we want to meet you where you are. and we're going to augment existing patient safety processes. These are the 8 required areas of harm that we are going to be focusing on under HQIC, and they include opioid stewardship and behavioral health, adverse drug events, which again are going to cover opioids, anticoagulants, and glycemic agents, CAUTIs, CLABSIs, C. diff, MRSA, and antibiotic stewardship, sepsis, pressure ulcers and injuries, and readmissions and care transitions. So these topics, again, should feel very similar to what we had previously been working on through HIN. For the data measurement, our approach is to maximize the use of claims and NHSN data to minimize provider burden. We currently have a list of proposed measures to CMS, which includes all claims and NHSN data, and are waiting for CMS approval, which we hope to be able to obtain prior to the end of this year. Once we do have those measures, we'd be more than happy to share with everybody because I know that is a question that a lot of folks are asking, and we're just waiting for that CMS approval at this point in time. The iPro HQIC approach related to patient-family engagement, again, this is going to be led by our AIR group, which is our PFE contractor, and they are the patient and family engagement subject matter experts that will support you in implementing the PFE best practices. You'll see there's some slight changes from the HIN work, and so now we're going to be focusing on these 5 items: implementing a planning checklist for planned admissions, and again, this is only for those that have planned admissions. So if you are a rural or critical access hospital that does not have planned admissions, you would not be expected to implement this metric. The second one would be implementing a discharge planning checklist, then conducting a shift change huddle and bedside reporting with patients and families, designing an accountable and responsible hospital PFE leader, and then activating committees in which patients are represented. So these are the 5 areas that we're going to be focusing on related to patient and family engagement. We're also going to be focusing on health equity. So this is programmatically structured. Health equity will be baked into our data analytics stratification, technical assistance, as well as our learnings. We're going to provide opportunities to share COVID-19 best practices with a health equity lens from across all of our network. And as you noted, there was 15 states that were included in our work. We're also going to provide support in identifying, implementing, and measuring the effectiveness of new strategies and solutions to meet the CMS obligated goals, which include collecting race, ethnicity, age, and language data, which we know are already supplied to each of the hospital associations through your claims metrics, identifying healthcare disparities in the HQIC patient safety focus areas, close identified disparate gaps in care or outcomes, and engage patient and families in all aspects of health disparities reduction work. So we're excited to continue the efforts related to health equity that have been started and further the progress in this area. I did want to take a moment and just introduce the iPro team, the Superior Health team under this iPro HQIC effort. And so we have designated staff for each of our states that are going to be working with you and your hospitals. So again, I'm Michelle Norcross, and I'm the HQIC Director for Superior Health. We have Christy Schaefer, who's the Quality Improvement Advisor for Michigan. I know many of you worked with her under HIN, and she was designated to work with all of our critical access hospitals and has some fantastic resources and expertise in that area. We have Jenny Schonecker and Janelle Shearer, who are working from the Minnesota area, and they are both, again, quality improvement advisors and have wonderful expertise in infection control and readmission. So we're really excited about that expertise that's being brought to the table as well. And then we have Jill Lindwall from Wisconsin, and Jill's another fantastic resource who has done a lot of work within infections and quality improvement in general. So we're really excited to bring this group together and be able to offer you each a designated resource at your own institution and be able to have that one-on-one designated support through Superior Health. So I know this is a really quick overview for today, and I'm hoping to be able to share more with you as more continues to be able to develop and gets created through the iPro team with the help of all of the subcontractors. But I really wanted to take an opportunity to answer any questions that you might have. We are trying to engage those that are really trying to consider if they want to participate in the HQIC work. And I'd love to be able to answer any questions that you might have live today and just take some opportunity to do that. So if you have a question, if you want to go ahead and you can raise your hand, Naomi can show you how to do that or how she can unmute your line. Or if you want to chat in a question, I would love to be able to answer any questions that you might have at this point in time. Naomi, can you inform folks how they might be able to unmute their lines?
Yep. So if you go to the bottom of your screen, there will be a unmute button or a mute button, or if you dialed in on your phone, you would use the mute or unmute on your phone.
And I can also answer some questions that I know have been coming into the queue as well to just kind of help in the interim as you might be thinking of some on your own as well. So I know one of the questions that has come in is that the topic area of falls is of particular interest, but was not listed on the required topic areas. And so that actually is listed as an optional topic from CMS. And so right now, my understanding is that hospitals will be provided with a list of any optional topics that are covered under the HQIC scope of work. And then if they would like to participate in those additional efforts, they are more than welcome to do so. So I know that falls is something that a lot of you are working on. And so that is certainly an area that we will be able to assist you with under the HQIC efforts. Another question that we've received has been about the data itself. And, you know, if you do not enter data into NHSN. So right now, we are working with iPro on how you can submit that data. That would be a numerator denominator if you do not already collect some of these metrics in NHSN. So I know that not all of the critical access hospitals, for example, capture their CAUTI and CLABSI under NHSN. So we are working with them on a mechanism to allow you to enter numerator denominator into the iPro data system and portal. Naomi, are there any additional questions in the queue?
There are no additional questions in the queue.
Okay, thank you. Well, I would just encourage you all to, if you have any questions, you know, you are more than welcome to contact us. Any of us, you know, you can contact me directly. I know that each of your state quality improvement advisors have been in contact with you and shared this webinar with you, as well as additional information on the work that we're going to be doing. As we continue to develop more with the iPro team, we will certainly be pushing that out. We are hoping to be able to recruit as soon as possible because we have a designated allotment of hospitals that are allowed to participate in this collaborative. CMS did put a limit or a cap on the number of hospitals that can participate, and Superior Health has guaranteed 125 slots for our hospitals under this scope of work. So we're really excited to offer you this opportunity, but space is limited, and I will tell you that we have already recruited quite a few hospitals. So, we want to make sure that you are all able to engage with us and participate in this work. But please don't delay, and you are welcome to enroll. I did include the link for enrollment if you're interested in doing so today. If you have questions, you can email me. My email is m as in Michelle, Norcross, Norcross @mha.org. I'd be more than happy to answer any of the questions that you might have. Additionally, your quality improvement advisors are available to you. So if you have any questions, if you would like to reach out to them and have a conversation, please don't hesitate to ask. We're more than happy to engage you in these conversations and continue the relationships that we've established with you already. And we're really hopeful that we can continue to partner with you under this HQIC work. So if there's no additional questions, I will give you the rest of the time back to this hour, and I really appreciate you joining us today.